Welcome to the topic of congestive heart failure. What is congestive heart failure? Congestive heart failure is a condition where the heart's function as a pump cannot meet the body's needs. The heart cannot move as much blood as it should with each beat. The term congestive is used because the blood in the heart cannot properly be pumped out, making the heart, quote, congested. Congestive heart failure can result in the failure of other organs and can eventually lead to death. There are two types of congestive heart failure. The most common is left side congestive heart failure. This is when the left ventricle can't properly pump blood for the body. This results in the building up of fluids in the lung, which makes it difficult to breathe. The second is right side congestive heart failure. The right ventricle has difficulty pumping blood to the lungs. This backs up in the blood vessels, which causes fluid retention and swelling in the lower extremities, abdomen, and other vital organs. Causes of congestive heart failure include uncontrolled high blood pressure, thyroid disease, obesity, alcohol and drug use, kidney disease, smoking, heart valve abnormalities, congenital heart defects, which are defects which happen at birth, and diabetes. Most of these causes make the heart work harder, and if left untreated can lead to congestive heart failure. Some of the causes listed, like alcohol and drug use and smoking, can be controlled by changing your lifestyle habits. Some of the symptoms of congestive heart failure include shortness of breath, fatigue, dizziness, coughing or wheezing, lack of appetite, fast or irregular heartbeat, congested lungs, fluid retention, and swelling. Usually shortness of breath is the first symptom to be noticed. The fluid retention of water causes the swelling in the abdomen, ankles, feet, and legs. Fatigue occurs when there's not enough blood being pumped out to the major muscles and organs, which leads them to become tired and weak. How do we diagnose congestive heart failure? First off, you start off by getting a complete physical exam from your doctor. Your doctor may then use one of the listed or multiple things listed to diagnose you. An electrocardiogram can be used to detect abnormalities in the heart. Kidney function test can help pinpoint reasons for fluid retention. A stress test can be used to assess the heart while under a workload. And an ultrasound can be used to check the measurements of the heart, the function, and the anatomy of the heart. As far as treatment goes, there are three main things you can do. The first is lifestyle changes. These can lead to a healthier life and can potentially help prevent congestive heart failure. Reducing sodium intake can help lower your blood pressure, which makes the heart work harder when you have high blood pressure. Quitting smoking and avoiding alcohol will also help the heart not work as hard. Exercise and a healthy diet can lead to weight loss and can take that stress off the heart. The second is drug therapy. Drug therapy can help through ACE inhibitors, which block angiotensin, which isn't good for the heart, beta blockers, which block stimulant hormones, and diuretics, which help rid the body of excess fluids through urination. If you're on drug therapy, you should take all medicines as prescribed by your doctor. The third option is surgery, which could include valve repair or coronary artery surgery. Surgery can prolong life, but it is not a cure for congestive heart failure. Nearly 5 million Americans live with congestive heart failure. One myth is that only the elderly can have congestive heart failure. That is not true. It can be in anyone, both old or young. 1.4 million people with congestive heart failure are under the age of 60. But most people, or more than 5% of the people between ages 60 and 69, have been diagnosed with congestive heart failure. Equally, congestive heart failure is as frequent in men and women. However, men ages 40 to 75 are more likely to have congestive heart failure than women. And more than half the people who are diagnosed with congestive heart failure die within 5 years of their diagnosis. In conclusion, congestive heart failure is very common. You need to be aware of your heart health, and if necessary, consult your doctor. Have a physical exam to help assess your heart health. Be aware and know the causes and the symptoms of congestive heart failure, and if necessary, change your lifestyle habits to help prevent congestive heart failure.